Hi, I'm Marley and welcome to this week's IGTV episode of Let's Talk. We're going to be talking about post-birth recovery. Now, we know that 75% of new mums reported that they weren't expecting the level of pain that they experienced in the fourth trimester. So there are a number of different issues that new mums may face when they've had a baby, and it does vary depending on what type of birth they have as to how they're going to recover from these different issues. Some women may well experience perineal pain, some perineal trauma, because we know that around 85% of women will have some degree of perineal trauma once they've given birth. Now, this may be in the form of an episiotomy where they give you a small cut, or it may be just natural tearing. So depending on the level of the tear, there may be some significant pain or there may be minimal pain. It just depends on each individual person's experience. Other levels of discomfort that somebody may experience when they've had a baby in the days after they've given birth are things like uterine cramps. We call them after pains. So this is when the uterus is trying to get back to its pre-pregnancy size. So what happens is the oxytocin, which is a hormone, is released from the brain and it causes the uterus to cramp down and contract, which is totally normal. But every time you have a baby, these after pains may appear more and more intense. So they usually happen in the first kind of 2 to 3 days after having a baby. Often they happen when you are breastfeeding as well, because the oxytocin that's released makes your uterus contract and cramp. Someone's recovery may well be affected by the type of birth that they have had. So for example, if somebody has had a cesarean section, we know it takes a lot longer to heal than a vaginal birth. They may well find that it is a much more difficult process. If, however, someone has had a vaginal birth, but they've had an extensive perineal trauma, or they've had a traumatic time during that birth, then again, they may well find it a lot more difficult to heal from and recover in the fourth trimester. If you've had a cesarean section, some of the things that you may well find more difficult are simple tasks like moving around, picking up your baby, particularly if you give birth in a birthing centre or in a hospital. When you're there overnight, perhaps moving around and trying to kind of lean over to the cot to pick up your baby might be more difficult than if you had had a vaginal birth. So taking those things into consideration are really, really important when thinking about your postnatal recovery. It's very important to look after your mental health, your mental well-being, as well as your physical well-being after you've had a baby. When you've had a baby, it can be a very overwhelming time. If you've had a traumatic birth, you've got that to think about as well. But even if you haven't had a traumatic birthing experience, the fact that you've got a new life to look after, you've got all this responsibility, and you are healing yourself as well as navigating becoming a new parent, it can be very, very overwhelming. So one of the things that we often expect when you've had a baby is something called the 3-day blues or day 3 blues. It doesn't always happen on day 3. Sometimes it can be on day 4, 5 or 6, but we do expect a little bit of tearfulness sometimes, or emotional kind of ups and downs. It doesn't usually last very long. It's usually only a few days or so. But if you're finding that these experiences of feeling sad or down, guilty, just depressed in general, are going on for a couple of weeks or more, then perhaps it's ideal for you to seek some advice or some help from your care provider. You can speak to your midwife, you can speak to your GP, you can speak to your health visitor. You can even speak to a friend or a relative, someone that may be able to help you to reach out to specialist support services. So because everybody experiences the fourth trimester in a different way, it's really important that you listen to your body and you rest when you need to rest. It's not easy to do that when you've got a new baby, when you've got a newborn that wants to be fed regularly, wants to be fed every hour or two. It can be quite difficult, and when you're trying to recover as well. But if your body is saying to you to slow down, then you need to slow down. It's really important to put the things that aren't a priority to the back burner. So when you've had a baby and you are at home, the things that you should be thinking about are looking after your baby, obviously, caring for your baby, feeding your baby, but also looking after yourself, making sure that you are nourished, making sure that you're eating, making sure you're drinking. And when your baby is sleeping, I'm going to say the cliche now, sleep when your baby sleeps. It is a bit of a cliche, but it is so important to do that, because if you are running on empty, then you're not able to look after yourself. One of the concerns that new mums have when they've had a baby is how to look after their perineal area, especially if they've had a little bit of trauma, so they may well have had a perineal tear or an episiotomy. One of the biggest complaints that I get is that it could sting when you pass urine, so when you go to the toilet. One of the things you can do, so here's a top tip, one of the things you can do to help this is to pour warm water on yourself as you are going to the toilet. Now, Lansdowne have these great peri-wash bottles where you can fill them up with water, and as you're going to the toilet, you literally just pour it on yourself, and it does relieve it because it can sting a little bit when you are going for a pee. If you're suffering from after pains, then you may want to just take some simple medications such as paracetamol. Try to avoid anything that's codeine based if you are breastfeeding. You can also use some heat therapy, like a heated water bottle or something on your abdomen if you're finding that it hurts. But the main thing to do is to make sure you give yourself as much rest and as much time to recuperate as you possibly can. So we've received some questions from Lansdowne mums, and the first one is, how do I relieve pain and discomfort during post-birth recovery? So we've already touched on some of the things that you can do if you're suffering with after pains, or if you have any form of perineal tear or any perineal trauma, such as using a peri bottle or using a soothing relief spray for the perineal area. But what about if you have some engorgement in your breasts after the first few days? It can be really uncomfortable in those early days as your breasts are filling up with milk and they're just trying to get used to how much milk your baby wants. They do settle after a while, but it can be quite uncomfortable in those early days. So one of the things I would say is to make sure you have a good fitting bra to help support your breasts. Also to make sure that you feed your baby on demand. So making sure you are feeding your baby on demand or practicing responsive feeding. So whenever your baby is hungry, make sure you pick them up and feed them. Don't worry too much about setting timers and clocks. You can use warm flannels on your breasts when you're in the shower. That can help to relieve some of the discomfort. And if you are finding that your breasts are too engorged to be able to get baby latched on in a good position, then you can always hand express some of the milk off just to make them a little bit softer before you put baby on. But the main thing is to remember that the engorgement does reduce after the first couple of weeks. So it does go down. Your breasts do settle when they figure out how much milk your baby is needing. So it's like a supply and demand. So another question that came in was, should I be using a soothing spray on the perineum post-birth? If you want to use a soothing spray and you find it beneficial, then absolutely go for it. Some of the mums that I've spoken to have used a post-birth soothing spray and have found it really helpful because it helps to cool the area, making it easier to move around. If you've got a significant perineal tear, it can be quite difficult to walk around and be mobile, which is really important to help to prevent the risk of developing blood clots in your leg. So some mums that I've spoken to have said that they found it really beneficial. It helps to cool the area down and just helps to kind of promote that healing. So the main thing is to remember that having a baby is a massive life-changing experience. It changes you mentally and physically. So just be aware of that and make sure that you take things slowly, that you don't put too much pressure on yourself, that you ask for help when you need it, and that you remember that your healthcare provider is always on the other end of the phone should you ever need them.